Hi, my name is Dr. Peter Lee here at Wave Plastic Surgery, and today I want to talk about a real sort of revolutionary medication that really helps us fight weight loss in patients, and that is tirzepatide or Mounjaro. This is one of the newer medications for actually diabetes, what we call GLP1 agonist or glucagon-like insulinotropic polypeptide agonist. Previously, there has been other medications that kind of work the same way, such as Wegovy and Saxenda. However, this is the first medication that actually works at another receptor called GIP. And we think that works synergistically to help patients lose weight by, number one, losing appetite. They don't feel like eating. And it works in the gastrointestinal area to cause early satiety, that is, the feeling of fullness after eating even just a little bit. And the food doesn't move particularly fast in the GI tract. It stays in there, so you keep on feeling full. Patients don't feel like eating. They don't really have a sense of hunger. And even if they eat a couple of bites, you feel full. And by working in this way, it clearly has demonstrated, both in terms of consistency as well as the amount of weight loss, that it works better than any other medication that has so far been developed. The way that we know this is that last year, July of 22, in the New England Journal of Medicine, where they took over 2,000 patients, divided them into 4 categories, where one category, placebo, the second had 5 milligrams, the third, 10 milligrams, and the fourth had 15 milligrams. And they did all of this with change in lifestyle as well, where they kind of adhere to a certain diet as well as exercise. And what they noticed, in the group of placebo, there was about 3% weight loss. And that's what you would expect with change in lifestyle. With 5 milligrams, they noticed 15% weight loss. With 10 milligrams, they noticed 20%. And with 15 milligrams, it kind of plateaus off, so about 21%. And based on this, it really blows away the efficacy of other medications previous to this. For example, like phentermine, okay, which is a common oral medication that people take to help lose weight. It's about 5% weight loss. With Saxenda, which is kind of the first line of GLP1 agonist, which you had to inject on a daily basis, that resulted in about 8% weight loss. Then in 21, Wegovy came into the market, and that resulted in about 15% weight loss, which you had to inject on a weekly basis. And now with tirzepatide or Mounjaro, that in a therapeutic range, which is around 7.5 to 10 milligrams, you can expect to lose about 20%. And this is also a weekly injection medication. We have actually seen some patients who's not really obese, who just had that extra 10 pounds that they actually want to lose. And it has really worked for them as well. In terms of side effect and tolerance, okay, for a lot of people, it's usually just gastrointestinal side effects, such as nausea, diarrhea, and constipation. In some patients, they feel a little bit weak, and you would expect that, obviously, with decrease in food intake. And some people, they feel they have a little bit of musculoskeletal pain associated with it. There has been, on a previous study on mice, some effect on the thyroid carcinomas. But certainly in every single surmount studies on humans, there has been no association with thyroid cancer. Right now, Mounjaro is not a weight loss medication. It has not been FDA approved for it. However, it is on fast track pace to obtain that FDA clearance. Currently, it's a diabetes medication. So, in summary, we really think that tirzepatide is a game changer to fight obesity as well as just weight loss in general. But obviously, you have to actually incorporate change in lifestyle as well. If you like this video, give us a like. And if you have any questions, please leave it in the comment. And if you enjoy a lot of these contents, which I hope you find useful, please subscribe.